Thanks for joining us. My name is Naor Khazan. I lead marketing here at Mindshift, and we're really excited to kick off a webinar for you. Today, joining me, I have two wonderful speakers. We have Tyler Wintz, our Chief Product Officer, and also Ashmit Pyakarel, who is our Senior Director of Product and Data Sciences. Say hello, gentlemen.
Thanks, Naor. Yeah, so we'll spend a little bit of time chatting about authorization and kind of the current status quo of authorization in the industry today, and then chat about how Mindshift is solving this problem. We think about authorization as a problem that needs to be solved from both the payer and the provider side of the equation. Susan Bailey from the AMA, I think, says this best, that ultimately prior authorization creates this burden that's undermining health outcomes. And we see this across the board in the way that data is reported about prior authorization, that the original intent of prior authorization is not ultimately being, or is not ultimately what we're seeing in the industry. And so thinking about why authorization even exists, both payers and providers want to make sure that patients are receiving safe, effective, quality care and control costs, both for the payer, but also for the patient, and make sure that they're receiving the right care for the right set of services that they need. And in reality, this is really not the way that prior authorization has panned out. It's become a complex, time-consuming process. It's fairly error-prone and really leads to these delays and undermining quality of patient outcomes, which is not what payers, providers, nor patients want in this process. And so today, the workflow that a provider would go through in order to get the authorization submitted to the payer and ultimately provide care to the patient is some kind of service is going to be ordered from a physician that's manually going to be keyed into some clinical system, an EHR, LIMS system, some system of record. There then is a stage where somebody has to go and look to determine if that service even requires a PA. There's maybe a search on payer websites, maybe there's an internal Excel workbook that's used, some kind of internal library of knowledge. Somewhere there has to be a determination of whether that PA even is required, or that a service even requires the prior authorization or it doesn't. Once the determination's been made that an authorization is actually needed for that service, you have to identify the best way to submit that authorization. So do I need to fax it? Do I need to go to a payer's portal? Do I need to make a phone call? Really figure out for this patient's plan, how do I get the authorization submitted? Fill out all of the details there, submit that authorization, and then monitor status on that authorization. 1 to 10 days, maybe if you have a full set of data that gets submitted the first time, you get that clean approval. If the authorization is rejected and you have to go through an appeal cycle, it can be upwards of a couple of months going through that process to really get the services the patient needs approved. And so across the industry, when we're thinking about all of the different transactions that have to happen for a patient to receive care, they need an eligibility check. They need to know what their cost of services is going to be. They need to get the authorization submitted, and then ultimately that claim needs to be filed. Of all of those transactions, authorization is the highest cost, the most time consuming, and has the lowest rate of electronic adoption. And in fact, only 26% of organizations are doing fully electronic authorizations. And that's not even touching the number of authorizations that are automated. Significantly fewer number of authorizations are automated. And so this is the problem that Mindshift's out in the industry to solve.
Right, and especially if you're one of our providers in the line, you can imagine that it is a significant strain. It's a significant burden for providers when it comes to prior authorization. To Tyler's point, it was intended for providing better care for patients, but now it's been such a complex, convoluted set of processes that takes a lot of time for you guys. So this is again from the AMA PA survey. As you can see, healthcare providers spend about 2 business days completing 41 prior authorizations weekly. So like, 2 days of those 5 days that they're servicing. 60% of the providers don't have a dedicated staff doing prior authorization. And then almost everyone, so 88% report high or extremely high burden for doing any kind of prior authorization work. So it is indeed such a very heavy kind of process, if you will, that Mindshift is now like kind of we're solving for that.
Yeah, thanks, Ashmit. And the challenge here, as Ashmit reiterated, is that this repetitive data entry. I saw that Zach said all of these different payer portals. There's a significant difference between all of these different portals. There's information gaps that need to be, what information needs to be collected for one payer versus another, for one set of services versus another. And this really creates a pretty significant burden on the provider who's already short-staffed trying to care for patients. And so all this additional administrative work just leads to less time spent with patients and ultimately lower quality of care for those patients. And so as the operational expenses continue to rise with the burden of authorization, we start to see things like claims not being resubmitted if they're denied for lack of authorization, significant number of denials of claims that could have been avoided with authorization, and all of this leads to patients paying the price for the care that they're going to have to receive. And so the challenge here, 91% of, sorry, Ashmit, on the next slide, 91% of healthcare providers have said that PAs are negatively impacting patient outcomes. And all of this, all of the denied claims or these denied PAs ultimately fall back on the patient to cover the expenses of their healthcare if they want the services that they need in order to continue to stay healthy. So the real question is, can we automate the prior authorization process? And this is exactly what we're working on here at Mindshift. This is exactly what we've done here. So when you take a look back at the process of what authorization looks like, when you go from a physician ordering some kind of a test or a drug or some kind of a treatment for a patient through to that claim being submitted, this process is significantly streamlined using the Mindshift system. So that data is put into the EHR at the LIMS. Mindshift has a set of integrations built into these clinical systems through HL7 Fire, through our robotic process automation, and through even through our own portal that can be embedded using things like Smart on Fire to automate the authorization workflow right out of the EHR, submit that to the payer automatically, and then populate the status of that authorization after it's been actively monitored back into the EHR, touchless from the provider. And so this removes that 10 to 20 minutes, 20 to 30 minutes, whatever amount of time was being spent previously on this authorization flow. And so you have manual work significantly reduced from the provider side. You don't need to worry about staffing more labor per patient in order to actually care for and provide the same level of care to patients. And that means you get to have your staff engaging with patients, providing better care to patients, and really doing what we say here at Mindshift is the work that matters, right? Helping patients get better so that they're not a patient anymore.
Sorry, I was muted. But as you can imagine, provider is, that provider side is only half the PA battle, right? Because as you can imagine, the burden for payers to also now review these prior authorization that are coming from different mechanism, the amount of time that they take, it's insane. So what we are working towards and what we are building here and what we have built here is a next generation PA solution that delivers bi-directional, right? So between payers and providers, so being able to submit that prior authorization instantaneously, and then in real-time connection between those payers, such that we're not only equipping ourselves towards solving for prior authorization, but also in the future when we are doing value-based care, as the relationship transforms, we'll be there for the both providers as payers as well. So, and this is this ease of transfer of data between different entities where like, both sides of the marketplace, if you will, have been in play, have been proved and proved again across different areas, right? Healthcare just remains to be kind of that one area where data interoperability, being able to like transmit data from like providers to peers to patients is becoming like it's more cumbersome and difficult. There has been quite a good amount of strides made on the healthcare side too, with patient access API and other new ruling that are being proposed and ruled right now. But we've seen this, like how with better.com, you can have like a direct mortgage from your mortgage provider to like the users or like to the people who are buying house very seamlessly. E-Trade, another very simple example, very seamless, like data transfer relationship between brokerages and retail investors. And then we've all heard about Carvana and how you can essentially, there's no middleman, there's no permissions. You're essentially getting the cars directly from the source. So what we're essentially trying to do is like kind of solve for both providers and peers while creating this like a pipeline, if you will, where all that data could come in rather quickly amongst, both those sides, if you will. So Mindshift, to my point earlier, it is both for both sides of the stakeholders, right? Both sides of the aisle. For the provider side, to Tyler's point earlier, we have products that enable you to do, automated benefit verification, like patient financial responsibility, finding out the right insurance provider, doing coordination of benefits, and all things are in prior authorization, right? Like, and that starts with like finding if prior authorization is required or not, right? Just at that level. Do I need prior authorization? Do I not need prior authorization? There has been a lot of studies done around this and how much providers are actually submitting prior authorization to the peers when there's not even needed one. So that can impact your administrative cost for providers. It can impact your administrative costs and time for peers. So there's like kind of plethora of effects with that. Then we also pre-screen the submission for errors. Using medical necessity of those kind of conditions, if you will. So what we essentially do is we can, as we get a request in, we can assess if it is providing, if the PA request has all the right data necessary. If it is, it has all the right data. If there's not, we'll provide missing information. If there is right data, we pass it against our, like an engine that essentially evaluates if that prior authorization is going to be approved or if it's going to be denied, such that providers from their end, they don't have to wait for like, a week or 2 week, or like, if there's a collective back and forth, like even longer than that to get the outcome. They can like kind of have like a sense of what the likely outcome is going to be. We can provide that recommendation much sooner in time. Then as the providers decide to pursue forth, we'll submit it directly over to the peer, and then we would be responsible for doing the status monitoring to make sure that, for the providers, it's just like one-stop shop, right? So they are checking if PA is required, they're checking if the PA would meet the medical guidelines and clinical necessities, and essentially assessing them. If they need to submit it, they'll submit it from our portal or our APIs, and then they'll monitor it using our portal or APIs. So it's essentially like, one place, and they don't have to worry about like, oh, this peer has this portal, this peer I need to send it through this fax, or this peer I need to like, sending it through this 278, 275 flow. So we take care of all that. And on the peer side, right? So like, this is where like Mindshift sits in the center, if you will. On the peer side, what we can do is like, once a prior authorization has been received by the peer, right? What we can do is we can provide a recommendation to them. So initially we are going to provide clinical decision support. So whenever a prior authorization comes in, if it should be approved, we'll give you reasoning for a peer that, oh, hey, John Doe came in and we think that you should approve this because it meets such and such criteria. If we think that it should be denied, we'll be like, hey, we think you should deny it because it does not meet, the right criteria that the peers are saying that it should meet. Over time, what we'd want to do is move more and more towards autonomous adjudication, specifically autonomic approval, such that peer resources or peer staff members are spending more time on your complex prior authorization that need like, series of reviews, and then they can automate approval of like, prior authorizations like diabetes prevention program, which have like, if you have a diabetic, if you have certain BMI, you're likely to be approved for that. So the whole intent is to like move them more and more towards automatic approvals. So Tyler, do you want to continue on this portion maybe? Unless
Awesome.
I missed anything.
Yeah, and I see we've got a handful of questions here, so I'll make sure that we wrap up here and have time to answer the questions and still finish up on time. And so ultimately, with the product suite that Mindshift is building here, there's a significant number of benefits for the provider: less manual work, real-time access to those PA decisions, especially when you're looking at those coverage requirements. Ultimately, better health outcomes for their patients because they don't have to worry about delaying care for those authorizations to be submitted and approved, and then eliminating those adjudication delays that come with waiting for a payer to approve and review that authorization. On the payer side, faster care, or that your members get faster care. There's less manual review that has to happen from the staff. You get immediate real-time view into what care patients are getting from that EHR. And so you don't have to wait until ultimately the claim is filed to get that insight that you need to know what types of care patients are receiving. You're still able to control both quality of care, types of care, and cost savings through the utilization management programs that are in place today, where there's no reason to throw all of that out with the PA program, but also you're able to comply with those new interoperability PA regulations that are being put in place from the CMS and the ONC. So turnaround time, types of APIs that have to be provided, all of those things come out of the box with the Mindshift platform. And at the end of the day, the real beneficiary of all of this, the person that we really care about is the patient, giving them better clinical outcomes, more price transparency, and give them the ability to focus on getting healthy and not have to be administrators of their own healthcare. This is really what we're all here for and what matters. And this is the biggest impact I think that we make by doing something like this in the authorization process.
Awesome.
So that's what we have for you today. So, oh, sorry, Naor.
No, sorry, Tyler. I was going to say, while we have a minute here, obviously we've got a bunch of questions in the Q&A. Thank you for that. Tyler and Ashmit will be answering them in just a few seconds. At the end of these, I always like to offer one additional poll. This is not shared publicly, but it's your opportunity if you want us to follow up with you after this webinar, just to learn a little bit more about the system or how we can help. This is a really quick way for us to be able to do that out of the hundreds of people on the call. So I'll leave this up for a second while Tyler and Ashmit go through the Q&A.
Awesome. Thanks, Naor. So handful of questions that are in here. Carmen, what about out-of-network patients in regards to costs? Yeah, so we have a large number of our customer base today are out-of-network providers. We handle patient financial responsibility and ensuring that we're accurately calculating what the patient's actually going to owe for those out-of-network services. So yes, indeed, we can support that. Let's see, will Blue Cross Blue Shield of Mississippi actually accept requests from this? Yeah, so we are agnostic to both the types of services. So I saw there was a question about ABA therapy as well. So specialties and subspecialties, we're agnostic to specialties and subspecialties. We have our platform is flexible enough to support all different kinds of specialties, and we have some type of integration to, I mean, for sure, all of the Blues, about 93% of covered lives is the number that of patients that Mindshift's platform will support. And so, yeah, Blue Cross Blue Shield of Mississippi, yeah, that's definitely one of them. But yeah, we support all of those payers as well as all of those subspecialties. We do support, there's a question here about drugs or only medical procedures. So Mindshift supports medical PA as well as drugs that are billed under the medical benefit. And so like infusion, typically this would be like infusion clinics or home infusion, those types of services, drugs that are billed using J codes, we support those as well. We do not handle any drugs that are billed to the PBM. We don't handle those authorizations today. That's something that is on the Mindshift roadmap, but we don't handle those today. Scheduling ancillary services and schedulers not knowing diagnosis codes. So for that, to know whether that auth is required or not required, the way to get the most specific answer to the or the most specific information about whether that auth is required or not is to use diagnosis codes. They are, however, the majority of the time, they are an optional field in the Mindshift system. You can still get an answer back on whether the PA is required or not. It will just be a more generic response than if you were able to provide those diagnosis codes. So you certainly could still do that, but doesn't. But the answer, essentially, what it ultimately comes down to, Tyler's asking the question here, is ultimately what it comes down to is there could be scenarios where with certain diagnoses, authorization is not required. But if we don't know what those diagnoses are, then PA could be required depending on the diagnosis code. We would likely tell you that PA is going to be required for that service, just because we don't know that what diagnosis codes your patient has and whether that excludes them from needing the authorization or not. Ellie's asking about hurdles in the implementation process, and so typically the biggest question that has to or the biggest component that has to get answered to make sure that the Mindshift product suite is implemented smoothly is how the integration is going to happen, and making sure that we have the resources on the provider side ready to go for the implementation. So if that is, we're going to do HL7 Fire integration to the EHR, as long as we have a technical resource on the provider side and we have a plan for how we're going to execute against that. Typically, our customers implement and integrate somewhere between, we've seen it go as fast as 30 days. We've seen it take longer than that. On average, it's somewhere between 60 and 90 days for the implementation. The other option is obviously using robotic process automation. We have customers who use that as well, and sometimes that can go a little bit faster if you have like an RPA COE or something within your organization that does those.
And Tyler, one quick note to add on that integration. While that integration is happening, as we demoed today, the portal is there. So while the hospital system is integrating with our services, they can also avail the use of our services using the portal.
Awesome. Yeah, very. Yeah, that's a very good point. Awesome. So delegated entity with payers, how do you communicate this recommendation? So yeah, so there's a couple of things with the Mindshift system, a couple of different ways that the product works. So if Mindshift is directly contracted with the payer, then yeah, we do become a delegated entity for that payer. And we can support those and have that approval come back as a guarantee, a fully adjudicated authorization or a real authorization with that you can use for your claim. If Mindshift is not directly contracted with that payer, we still have the ability to provide you that recommendation on likelihood of approval or denial. And so that likelihood, that recommendation of approval or denial, that comes back through either through that same channel, through the API, or directly through that workflow, that portal workflow that we showed before you submit, where it would show, hey, this is you're likely to be approved, or you're likely to be denied because your patient doesn't have evidence of 6 months of physical therapy treatment, or whatever the criteria might be that's going to be needed to provide that evidence of medical necessity for the payer. All right.
There's a question around, would the platform be suitable for imaging authorizations? The answer is yes, absolutely. We actually work with a few diagnostic labs as well as like imaging labs. So that's as well as radiology labs. So that's absolutely possible. Mindshift actually started doing more of post-acute services. Now we do both post-acute as well as acute, but like we actually have a very big footprint on imaging as well. And there was one question around, you may have said this already, but does this integrate with the EHR? Yes, absolutely. So the FHIR portion that we've been talking about, the HL7 FHIR. So there are several EHR systems that are already in HL7 FHIR. So if they're already in HL7 FHIR, then it's very, very seamless to integrate with any EHR. If they're not in FHIR, it is still seamless because our APIs are pretty nimble and pretty lightweight. So we've seen, like providers and like hospital systems not having too much of issues with integrating with us through their EHR.
So there's a question about pricing. So the Mindshift product suite is priced as a SaaS subscription. So you essentially pay per month for access to the platform for whatever size your patient population is. So if you service 1,000 patients a month, then you subscribe to the tier that gives you access to run all the transactions that are needed in the platform for those 1,000 patients. Right. Last couple of questions here. So how are appeals addressed in your tool? So we have a team that can handle and help with the appeals process. Ultimately, the appeals process becomes significantly more, really becomes more manual through phone calls and peer-to-peer and these kinds of things that have to get set up through with the payer. So if there is an appeal that needs to be filed, then which is I'll just say is significantly reduced using the Mindshift system, just because we ensure that patients are meeting medical necessity, that they have all of the information that's actually needed in order to get that authorization cleared through the payer. But if there's an appeal that's needed, we have a team that can help manage the appeals process, or we have a large number of our customers who have still a small internal team that essentially what they manage is any appeals that they need to process.
There was another question around ABA therapy and kind of expanding that in many cases, our dedicated department for behavioral health has a system being able to capture information from the right areas for the PA. The answer is yes. So the system is designed such that, as you saw in Tyler's workflow, there are different ordering provider, servicing provider, referring provider, PCP information. So we would, so if something on ABA is like dedicated to like Magellan or like New Directional Behavioral Health or kind of other third-party entities, we'll work with the providers to identify what would be the right route to send that prior authorization from and where to source that data from. So that we've actually seen cases where, you have like your specialties like kind of driven to like another third party and them doing PAs. So that's absolutely possible.
All right. Well, that's all the questions. Again, this is being recorded, so we will be sending out the recording for you tomorrow. Ashmit and Tyler's emails are here, so feel free to reach out if you have any additional questions or want to chat about a specific challenge. We love those kinds of conversations. We're happy to have a strategy call with you. But other than that, a big thank you from all of us at Mindshift. We know your time is very valuable, and to be sitting here with us for just about an hour, we really appreciate it. And we're going to be producing some more content for you soon. So take a few seconds to answer that survey for us. We really appreciate your input there. And we'll see you next time.
Thanks for your time today, everybody.